in a listen-only mode today for our webinar, and we thank you for joining us. We ask that you use the Q&A function at the bottom of your Zoom window to ask questions. Carolyn Miller is here and Tina Elliott is here with us. If you have technical issues, please use the chat function and chat to Carolyn Miller. I am not going to be watching the chat or the Q&A during the webinar. I'll stop every once in a while and then at the end for questions and answers. So without further ado, I'm going to go ahead and share my screen. All right. You guys see my presentation? Carolyn, am I sharing the right screen? Okay, thank you. All right, so again, my name is Becky Sanders. Welcome to this webinar on behalf of the Upper Midwest Telehealth Resource Center and the Illinois Rural Health Association. The Upper Midwest Telehealth Resource Center covers 4 states, the states of Illinois, Indiana, Michigan, and Ohio. So I can't talk about what we do here at our center without talking about our map and all of our regional partners. There are 12 regional telehealth resource centers around the country and 2 national telehealth resource centers. We are all funded under HRSA, under the Office for Advancement of Telehealth. And we've recently updated our national website, and you can go to that website and click on an interactive map and reach out to any region or national center. When folks ask me what it is that I do for a living, I tell them that I'm a virtual librarian, because that's really, especially with COVID, what it feels like. We spend so much of our time answering emails when people have questions about how to build a telemedicine program or a telehealth program, how to bill properly for virtual visits or telehealth visits. And we provide a lot of resources on our website at umtrc.org. We also connect folks. You know, if we get a question on maternal mortality, there might be a specific program that we would go to and say, hey, you know, can you talk to this other program, so that they can share best practices and not have to reinvent the wheel. So our objectives today is that you will be able to discuss steps to incorporating telehealth into your organization and discuss the importance of SMART goals and objectives in a work plan, and also able to discuss proper telehealth decorum for providers and for patients. So let's talk a little bit about terminology right off the bat. So telehealth versus telemedicine. Telemedicine historically has been that clinical encounter between a patient and a provider, and telehealth is the overarching term for anything that happens electronically using data, where there's CME involved or education, that type of thing, but happening at a distance between the person teaching that information and the one receiving that. In the last 3 to 5 years, we've also heard a lot of other terms starting to crop up. E-health for electronic health, M-health for mobile health, with all the healthcare apps that we have at our fingertips on smart devices that we wear on our wrists or some type of activity band, the apps that we have on our smartphones or our tablets and computers. I've also heard the terms video visit and virtual care being used more and more, especially with COVID. And with some of the legislative changes we've seen in state Medicaid programs, many states are taking out the term telemedicine and using the term telehealth instead, just to be more encompassing with everything that goes under the term of telehealth. So when we talk about delivery modalities, telehealth is just another delivery modality instead of seeing a practitioner in person. So it's just another way of delivering the same quality, and clinical services that you would receive in person with a provider. Now, under the term of telehealth, that all-encompassing term, there are two types of telehealth that I will talk about. And again, these are different modalities within telehealth. So the first is synchronous, and that is a live and interactive conversation using audio and video technology between a patient and the provider. This is generally conducted via a HIPAA compliant platform. There are some relaxed regulations right now around HIPAA, but it is important to note that this public health emergency we find ourselves in is not going to last forever. So you do need to spend the time to vet a proper HIPAA compliant platform for your telehealth encounters. A store and forward type of telemedicine or telehealth is also known as asynchronous telehealth. So it happens one way. So it's kind of like a walkie-talkie that's just one person can speak at any given time. This also needs to be over a HIPAA compliant secure platform. And a great example of why you might want to use store and forward telemedicine is for taking, like a dermatology example would be for taking pictures of wounds or rashes or bug bites and submitting them. Maybe a primary care person takes the picture and submits it to a dermatologist who comes back and says, oh yes, that's poison ivy or poison oak or whatever, so that the primary care practitioner can appropriately write a prescription. So the meat of what we're going to talk today is how you develop a telemedicine program and what's the culture involved in that. So we're going to talk about three basic parts of doing this program development for a telemedicine or a telehealth program. So first, we're going to assess and define what it is that we want to do. Then we're going to talk about developing our structure for the program and planning out that program. And lastly, we're going to implement that program and we're going to monitor it. So it's very similar to thinking about a plan, do, check, act cycle, because you always want to stop and assess where you're at different points in the program, and then set those baselines so that you can properly measure outcomes. And I love to use this book. I read this in the mid-1990s called Who Moved My Cheese by Spencer Johnson. And it talks about the types of change that happen in our lives. Sometimes we can control the change and sometimes we can't. We just kind of have to suck it up and go on. But the four characters in this book really, to me, exemplify the types of personalities that we find in our workplace. So there's four characters in this book. Him is the stabilizer and just wants everybody to get along. Scurry is the producer. Scurry is very focused on providing results and doing everything quickly and getting it done. Haw is also a unifier. He wants everybody to get together, very process oriented, but doesn't have a real structured approach. And then Sniff is our innovator. It's about technology and shiny objects, or shiny-itis, as I sometimes call it. They are results orientated, but they think way down the line, 5 years, 10 years down the line. So if you think about your own workplace, you'll probably find someone in your workplace that you would identify with each of these characters. So there's another book by Alexis Cisney that takes this approach, the stabilizer and the unifier and the producer and the innovator. He uses a term organizational physics, and he takes it to the next level about who these people are that we work with in our work environment, and how can we pull them together as a team on a single platform or a single program plan and get everyone to focus on the proper results at the proper time. So when you want to incorporate telehealth into your organization, the first thing you need to do is assess and define the pain points in your organization that telehealth can help alleviate. And then we're going to develop and plan. And then we're going to implement and monitor. So, assessing and defining that. So you need to assess your service needs. And I like to use examples of behavioral health because they happen so frequently. And with behavioral health, all that you really need to do is to have that audiovisual platform, be it Zoom like we're using today, or video, or Skype has a HIPAA compliant platform. There's so many vendors out there. I'm trying to throw out a bunch of names. American Well, VC, Ring Central, all of those are HIPAA compliant video conferencing platforms. So when I use behavioral health as an example, it is because we don't need to worry about digital peripherals. We don't need to worry about digital stethoscopes or digital otoscopes or digital tongue depressors or digital exam cams. We just need some type of a video platform that is secure. So when we look at some of the low-hanging fruit, and what we really need to do is look into the organization. Do you have someone that's a visionary in your organization that can be your telehealth champion? Someone that the leadership has said, you know, you're going to be the point person on this. You go forward and you do all the research, and we're going to give you enough time in your day to do that. We're going to remove some of your other responsibilities so that you can properly develop this program. You've got to have that corporate willingness, because if you say to someone who has got a full plate, hey, I want you to research this, and they're putting out fires all over the place, they're really not going to have time to do an in-depth research and look into all of the different pieces that are part of a puzzle of developing a culture of telehealth within your organization. So what you need to do is look at, once you've figured out who that person is, you want to look and see what services are not available in your organization that you could be providing. Maybe you have specialists in your organization that could be, instead of driving out and doing rural rotations for cardiology, that could, or having patients come into your to an urban setting, you could allow those patients to stay with their local healthcare organization, be it a family practice or a local small critical access hospital, and then use your video conferencing platform to see the provider who is at a distance. So again, you could look into genetics is very popular these days, behavioral health, diabetes education, all of these things that I'm mentioning that you really don't need a lot of digital peripherals, and it's really more about the conversation. So as you look at, and I prioritize the different services that are needed within your organization, one of the ways you might want to do that is to look at something called a CHNA, a CHNA, which is a Community Health Needs Assessment. Now, for critical access hospitals, these are done once every 3 years, and they're publicly posted on their website. For local health departments seeking certification, they're done every 5 years. And within that information, in order to create a CHNA, there are different studies and focus groups involved to really assess the needs of your market area and what could be improved. So it'll help give you some program assumptions and some constraints when you think about offering services via telehealth. One way that you can also look at developing a telehealth program is to either apply lean healthcare or Six Sigma methodology. So we've got some the lean 7 deadly wastes: overproduction, waiting, transport, motion, overprocessing, inventory, and defects. And these are very similar to Six Sigma when they're talking about defining, measuring, analyzing, improving, and controlling different processes. So it doesn't really matter what your training background is. Both of these philosophies are talking about reducing waste in your work environment and producing more effective results in your work environment. So I was in Louisville several years ago, and in downtown Louisville ran across these recycle bins that I thought were very innovative in reducing waste. So they're solar powered recycle bins and trash bins. So I thought that was interesting. All right, so the next step after we've assessed and defined the problems that we want to solve with a telehealth program, then we can start to actually develop and plan what we're going to do. So we need to define and specify the program model. In that, are we going to do behavioral health or genetics or diabetes education? Are we going to do telestroke, telecardiology, tele-ICU? And that'll depend upon what you found in your market assessment. You really need to define, where are your patients? Are your patients within your market area or not? And then what services do those patients need? What technology do you need? I've been talking a lot about video conferencing platforms, but with some services, you are going to need additional information, additional vital signs from the patient, an MRI, those types of things. And then what is the best organizational model within your organization? How does your organization work? Are you a Cisco shop, or what EHR are you using? Are you using Cerner or Epic or Allscripts? All of this information, when you start pulling it together across interdisciplinary teams, from your medical staff to scheduling, to the medical director, to nursing, all of that, to IT, it all has to come together, and you all have to be on the same page to make this work. So at what point do you want to get human resources involved, or do you have enough human resources? Do you have enough bodies to actually make this happen? And as far as facility related resources, here we're talking more about IT, computer programs, and staff to troubleshoot technology issues. And then who's actually going to provide that service? If you decide you're going to do behavioral health, do you have a psychologist? Do you have a psychiatrist that will actually provide those services? Or do you need to seek out a vendor or a third party service? So there might be some legal and regulatory constraints as you look into who is going to provide those services. Are they licensed in the state where the patient's located? Because licensure is a big part of that. And then what's your implementation approach? Generally, I advise people to use kind of a phased or implementation approach. So you start with a pilot and with a small group of people. Maybe you look at your payer mix, and if you're operating in rural, probability is high that you have a large payer mix of Medicare and Medicaid patients, and then a small amount of commercial insurance or private pay. So you may look at your Medicare patients first and see if their needs for this particular type of service are higher than your Medicaid patients. Do you have enough data on those patients to say, well, this group has the technology skills, then they have adequate broadband access at home, they have the knowledge to use the systems that we want to implement? That's kind of, you have to answer that for yourself. Is your organization willing to purchase smartphones or tablets for your patients so that they can use telehealth at home if they don't have existing tablets or smartphones at their homes? Medicare patients are going to typically be your elderly. They may not be as tech savvy, so they're going to need a simple solution. So these are all of the things that you need to think through and make sure that you're meeting the needs of your population. All right, so with the lean healthcare thought process, One of the tools that we use is the 5 whys. And I'm going to give you an example here, but this is really what we call an analysis tool to find the root cause of a specific problem. So the problem here in our example is that I ran through a red light. Well, why did I run through a red light? Well, I was late for work and I was trying to hurry. Well, why was I late for work? Well, because I woke up late. Okay, so why did you wake up late? My alarm clock broke. Why did your alarm clock break? Well, I didn't check it the night before. I didn't set it. Okay, so you found out that the problem is that you ran through a red light, and that is what you think the problem is, but it's really because you didn't have your act together last night and you didn't set your alarm clock. You didn't make sure that it was working. So by taking a deep dive into some type of a root cause analysis, then you can determine where you really need to focus your efforts. You don't need to put a little Band-Aid on something that is really a much deeper problem. All right, so as we develop our business case for this new telehealth program, as I mentioned earlier, one of the best places to go to get data is a community health needs assessment. So your community can tell you and provide you all kinds of feedback on what they would like to see from you. You also have to make sure that you stay within your mission and the needs that your organization can provide. If there is, I'm trying to think of a good example, a rural health clinic, for example. If you work at a rural health clinic, you probably don't provide dental services, but maybe that's something that your population around you needs. So how do you go about doing that if you're a rural health clinic? Well, maybe you look at changing and becoming a federally qualified health center, or you partner with another qualified health center, federally qualified health center, FQHC, that does provide dental services. So that goes back to your organizational mission. And you're going to need a little bit of financial commitment from your leadership to go forward. It may not be a lot, but every budget is different, and you need to take that into consideration when you say, hey, I'm going to start this new program. Tracking program savings. So telehealth is not a get-rich-quick scheme. You are going to save more money by reducing efficiencies and seeing more patients and having a higher throughput. You're going to be able to track patient miles saved, provider miles saved, depending on how you do your scheduling. We would recommend that you take a chunk of time. Maybe it's a couple days, 1 day a week, or a morning 1 day a week, or an afternoon, or a full day 1 day a week, and set aside that for seeing your telehealth visits. It can be a little disconcerting between a provider that's seeing in-person patients and telehealth patients back to back. When you bring a patient in person, there's usually some type of a medical assistant that is rooming the patient and taking their vitals and all of these other things. So the patient has more lag time on the front end before the provider comes in. When you have a telehealth visit, the provider or the patient is in the room. Someone might assist them to make sure that the technology works on their first appointment and all that, so they can get into the room where the visit's going to take place. But then they're waiting. And waiting in a doctor's office clinical patient room is a lot different from waiting in a video room where there's nothing going on and the expectation is that the provider is going to be right there. So that is why we recommend scheduling your virtual patients back to back and not necessarily mixing them with in-person visits. It can be done, but it takes a little bit of finagling and a little bit of getting used to for the provider to switch from setting to setting. All right, so back to our 4 characters, him, haw, sniff, and scurry. Again, who are you within these personalities? What is your personality in the workplace? Are you a stabilizer or a unifier or a producer or an innovator? And thinking about those personality types and who you want on your team as you develop your plan, you might go back to these personality types and say, this person is just not going to mesh well with the other team members. This is another essay that I like to share about who moved my cheese, and really the perspective, the thought process around how cheese gets moved. And cheese represents anything, maybe it's your computer, or maybe it's your desk chair, there's all kinds of change in our lives. So who moved my cheese? You need to monitor, sense, and evaluate your surroundings, because business changes, threats, and opportunities. So I moved your cheese because I am giving you the opportunity for innovation, entrepreneurship, creativity, problem solving, and business growth. When you move the cheese, you want to use available resources, strength, and limitation to address the situation changes or situational changes to an organization's advantage. You're going to revamp your strategies to adapt in external situations and remain competitive. And you always want to address resistance to change in your employees. So give them, if you're going to change the game and your design, how do you do that with the most positive effect on your employees? All right, so we've talked about assessing and defining what we want to do. We've talked about doing some program planning. And now we're going to really get into the program plan and the technology. So we're going to talk about work plan objectives. We're going to see a sample work plan and talk about SMART goals and objectives. So first, you need to identify who's the leader for this particular program. Hopefully it's your telehealth champion that has been given the time and the okay from the executives from the top of your organization to go and run with this program. And then you need to identify your team members, who's going to be part of the team, and think about all the different pieces that you're going to have. And then how are you going to market this? You need to have someone within your organization that is responsible for, maybe you have social media accounts, Facebook or Twitter or LinkedIn, and someone needs to be responsible for that, because you can have the best program in the world, and if nobody knows about it, you're not going to have any patients, so it's not going to be financially sustainable, or it's not going to be have a good outcome. So depending upon where your organization is, if you're in a rural town or a big city or a medium-sized city, you will know best, your marketing person will know best how to reach out to your surrounding community. Is there a local TV station where you could place ads? Does your organization have a social media account that you can do a small video ad or use text and infographics to advertise this? Do you want to do a direct mail campaign? All of these things are possible. Only you within your organization, within your team, can decide what is best for your particular situation. And then as far as policies and procedures, we do have some sample policies and procedures on our website, but what we really recommend is that you look at your existing policies and procedures. You don't need a whole new way of doing things, new policies, just because you're incorporating telehealth. You're still providing the same clinical service to your patients. You're just using a different modality. So look at your existing processes and procedures, and do you need to put a sentence or two in about allowing the patient to receive services via telemedicine? You probably want to look at consent forms, so the patient consents to be seen via telemedicine. And this sometimes can be incorporated into your annual HIPAA paperwork, or if you see the patient for the first time via telemedicine, or via video, then the provider can actually read the consent form to the patient, and then have the patient somehow receive that form later and sign it and send it back. But you can document it as a verbal consent as part of a telemedicine visit. When we talk about consent, there's so many different ways to do it. You want to check your state laws. In our region, we have information on consent and sample consent forms, and we can send you what it says in your state law. But you can think about that in a variety of ways. If you've got a new patient coming on and they're going to be seen via telehealth, maybe you send them a link on a website, or you mail them forms through the mail for them to complete and send back. You might have a patient portal set up. There's lots of ways to accomplish that. It's just going to depend on variations within your organization and how you, within your organization, communicate with your patients. Scheduling, I've already mentioned that, thinking about that. And then process integration. The best way to integrate telehealth and video conferencing within your organization is to use it within your organization. So as you communicate with staff in your organization, if they're in different buildings, or even at, in the same building, but spaced apart, you can figure out what video conferencing platform you want to use and then use it. The more often your staff and especially your medical staff and your nursing staff use it, the more comfortable they're going to become with it. So you need to think about, how are you going to train your staff, and what equipment are you going to train them on so that they can be pros when they start working with the patients. So now, talking about our actual objectives for our work plan. One of those objectives needs to be, where's that space? Now, this is considering that, or based on the assumption that the patient is going to be in a clinical setting. So they're going to be in a patient room, which is different from having the patient at home. And we'll talk about the patient at home in just a couple of minutes. So broadband access or internet access is your foundation for any telehealth program. If you don't have adequate broadband access, your program is going to be like a house built upon the sand, and it's not going to be viable. So you need to have your hardware and software needs. So someone probably within your IT department, or whoever provides that service for your organization, is going to need to be involved to make sure that you have what you need. When you think about that broadband, you want to have someone talk to your service provider, if it's a telecommunications company that you're using, or an internet service provider, and take a look at those contracts. What clauses are in that contract? If you lose power, if you lose service, make sure that you have adequate maintenance support agreements in place. And then the interoperability. I mentioned EHRs before. So your electronic medical records, some of them do have built-in modules that you can purchase that have a video component built into them, so that when you're taking your notes in your EHR while you're doing your telemedicine event or your telehealth event, you're not doing double entry. You're not using one program for your video consult and then transcribing that into your electronic medical record. So the more that you can streamline that process, the better. And again, organizational approval. If you're going to spend money, you're going to need to have someone approve that. All right, so outcomes. We need to have a baseline before we can measure our outcomes. So what are our goals? We need project goals and outcomes and objectives. These could be related to patient volumes, so you can measure and track and achieve goals. If you don't set goals, you'll never know if you've achieved them. So what is the impact of tracking data? So you have to develop a data collection methodology. And again, this is kind of like the consent forms. How are you going to collect the data? Is someone going to come on the video visit at the end and conduct a survey, an oral survey with the patient? Are you going to send the patient a link to follow? At the end of the telehealth visit, are you going to email the patient a link to do a survey? Are you going to mail them a paper form? Are you going to text them a link for the survey? All of that has to be figured out before you see your first patient. And what we're going to do as far as outcomes and monitoring once you implement is, after the first day, after the first week, have your team get back together and talk about what went wrong, what went good, what went bad, what can you improve upon, what happened that you had never thought of before, and then you're going to tweak your program and continue. And so then every week or every month, you're going to bring that team back together, rinse and repeat. What went well, what didn't go well, what can we improve, what new things do we need to think about, until you have a well-oiled machine as far as your program goes. So when we talk about improving our program, we're going to define those improvements, and the same thing, define, plan, implement, test. And test is so important. Don't forget to test. Test your platform with your providers, with your, maybe pick some patients, maybe pick some employees to act as patients, do some role play to really get your providers familiar and comfortable with whatever platform you choose. All right, so here's our sample work plan. And I will apologize, I did not remember to update this before today. So this is kind of in the past. But we start out with a goal, and we have to determine what our goal is. What do we want? And again, I like to use behavioral health for my examples. So our goal is to reduce emergency department or ED wait times for psych consults. In many hospitals, patients will come in and need a psych consult, and they might have to wait 24 hours or more until someone can come in person to do a psych consult. So if we implement telehealth in our emergency department, and we either have a psychiatrist on call or we have a third-party contract with a psychiatrist who can do that for us, we can reduce those wait times. All right, what's our strategy and objective? How are we going to get to this goal of reducing ED wait times? Well, we're going to do that by providing telepsych services in the emergency department. What are the activities that we have to do? Break this down. How do you eat an elephant? One bite at a time. So we got to break this elephant down and figure out all of the different pieces and the moving parts to make this happen. So if we're going to provide psych consults in the ED, well, we need to have a physical place for that to happen. We're going to have some video technology, and we have to have a provider. So in the example here, so who's going to do this? Well, who's going to take responsibility for the different pieces? In my example here, we have 3 people on the team. We have our team lead, and they're in charge of finding a space. We have team member A, who is going to look at the video technology and do their due diligence and figure out what works best for your organization. And then team member B is going to handle finding a psychiatrist or vetting a third-party entity to provide those services for you. How long will it take? Back in March and April of 2020, when COVID hit the United States, we did many things much quicker than we'd ever thought we could ever do them before. Many organizations started telehealth programs overnight. So I would say give yourself 6 months. If you're already providing telehealth, take a step back and look at your program. What can you improve in your processes and procedures to make it more seamless, to increase your throughput on your patients? So how do you know if you've achieved your goal? Well, if you don't set a goal, again, I said this before, if you don't set a goal, you're never going to know if you've achieved it. So in this example, we want to see 20 patients via telepsych by the end of the 3rd quarter. Now here we are, we're almost at the end of 1st quarter of 2021. If our goal to meet is to start the program in 3rd quarter, and then by the end of 3rd quarter, say All right, we've got 3 months. We're going to see at least 20 patients. So break that down. How many patients does that mean you have to see each week? Well, there's generally 12 weeks in a quarter. So you have to see either 1 or 2 patients each week to meet that goal. The other thing that is very important about work plans is when you write these goals and these strategies and these objectives and these activities and your outcome processes and measures, they have to be SMART. So SMART stands for specific, measurable, achievable, relevant, and timely. Don't set yourself a goal that you're going to see 20 patients in a week. Start off small, and then you can always increase your goal. I love to set small goals because then I can totally overachieve them. If I set stretch goals and I don't achieve them, I'm very upset with myself. So you always have to have a timeline. So you see here in our time period and our outcome processes, there's specific timeline involved because we want to see X number of patients by a certain date. That way we know that it's a very clear if we did or didn't meet that goal. And we want to set them achievably. All right, so now we're into our implementation and monitor phase. Make sure you have a communications plan in action, that it's very clear, everybody's on the same page and they know what they need to do. As you're starting to implement, you need to identify and mitigate any risks. If you realize all of a sudden you didn't get the media person in your organization, they didn't send anything out on social media, then that's hopefully fairly easy to get something together and send out via social media. If you forgot to get your consent forms in place, then you're going to email your consent forms, or you're going to post it somewhere, and you're going to send a text to your patient, and they're going to go out and look at that online. Maybe they could submit it online. But make sure that you go back and you look at everything, all of the steps of your processes and procedures, and mitigate the risks so that you can move forward successfully. And then monitoring. I've already talked about this. You need to set up throughout the process. You should have weekly team meetings with everyone involved, or at least the lead individuals involved. And then you want to continue those after you implement your program so that you can talk about, again, what went well, what could you do better, what did you not think about, what new things need to be added, so you can tweak that program and make it the best you possibly can. So it's really all comes back to that to the theory about plan, do, check, act. This is one of the last quotes that I love from Who Moved My Cheese. So change happens. They keep moving the cheese. Anticipate change, monitor change, smell the cheese often so you know when it's getting old. Adapt to change quickly. The quicker you let go of the old cheese, the sooner you can enjoy the new cheese. Change. Move the cheese, enjoy change. Savor the adventure and enjoy the taste of the new cheese. Be ready to change quickly and enjoy it again, because they keep moving the cheese. All right, so implementation is not as easy as it sounds. We've talked about some change management theories. We've talked about work plans. Now we're really going to look at some of the good, bad, and ugly and problem solving around where's the patient going to be during the telehealth visit. If you're interested, you can send me an email. I'll have it at the end. There's some really good videos out there. The Midwest Genetics Network put together that talk about clothing that you as a provider or as a patient to stay away from really bright clothing or heavy jewelry that clinks when you move, those types of things. You want to have a professional working space. As a provider, that is extremely important. I've got my logos for the different parts of the organizations that I'm involved with on my background. You, as a provider, you might have a jacket that has your organization's logo on the lapel. You might have your degree in the background so that people can see your degree, or depending on how far it is behind you, they may not be able to read it. You want to keep your background free of clutter and distractions, minimize external noises, and there are some acoustical tricks we'll talk about. And really important is lighting, so that your face isn't in shadow. And then we'll talk about wall colors. So typically, if your patient is going to be in a clinical environment, they're going to be in an existing patient room. So you may not have a lot of control over the color of the walls or what's on the floor, but you do need to have at least a computer and a webcam to make the visit happen. As far as the location of the room, you want it to be in a quiet setting. Now, if you're going to be in the emergency department, that may be difficult. You may have to see if you can do a little bit of sound isolation around the door to that room. Try not to have that room right by a noisy elevator or a stairwell, or right by a parking lot or restrooms where there's a lot of noise going on. Microphones are sensitive. I'm not using my headset today, but sometimes using headphones or some type of a headset does help to reduce external noise. Looking at technologies for that is something that's important as well. Windows, I do have a window beside me. I've got the blinds closed to minimize that light, but it really hits me in the morning because the sun comes up over here. So the room sizes depend on what you're going to do. I've talked a little bit about services that are educational services, and the type of equipment that you need, again, is dependent upon what type of service that you're offering. You might need conference seating if you're doing clinical education. If you're doing a specialty consult, it's probably just the patient and the provider, so you don't need as large of a room. You may or may not need an exam table. Depends if there's going to be a medical assistant in with the patient during the entire visit. So again, here's our picture of a patient room, and really you just need enough room to move around comfortably for whatever it is that you're doing. Now with COVID, all insurance providers are allowing patients to be at home. We do, just a couple notes on that, with Medicare specifically, they are using codes with patients. They haven't specifically lifted those geographical and clinical requirements. Right now during the public health emergency, they're lifted and patients can be at home. We believe that in the Trump administration, they were issuing the public health emergency every 90 days for the public health emergency and all of the waivers that took place around telehealth. The Biden administration has come in and they said they think that they're going to extend the public health emergency through the end of 2021, and that they would give 60 days notice before they ended the public health emergency. So right now, we're still under a public health emergency from the Trump administration at the federal level that ends at the end of April. So sometime between now and the end of April, we'll have to wait and see what the Biden administration decides to do. Every year, Medicare puts out a Medicare Learning Network fact sheet with all of the codes that can be provided and reimbursed via telehealth. They are moving away from the audio-only codes that they issued during the pandemic, and they have a new G code that they're going to use through the end of this year, through the end of 2021. And they're asking that when the claims come in, they're going to be taking a look at that data and seeing how much it gets utilized, and then make their decisions later in 2021 for what's going to happen in 2022. Of our 4 states, most states are looking at making the originating site where the patient's at to continue to be allowed to be at home even after the public health emergency. Michigan was the first to do that, and they made that permanent in June of 2020. Actually, no, before that, Ohio released a rule in July of 2019 allowing the patient to be at home. So they were even before COVID. Michigan was planning to do that and allowing the patient to be at home in March of 2020. COVID hit right at that time, so they had their executive orders, but then they made the laws permanent in June of 2020. In Indiana, there are bills currently open in the legislature to make some of those changes, so we probably won't know until the end of April if those changes will become permanent. There are also bills in Illinois, and again, we won't know until the bills session finishes if those bills are going to go forward and be made law. So one of the more important things for patients is to think about privacy, because I can tell you that I have no one in the room with me and my door is closed and locked, so no one else in my home can get into my home office. But I have also heard patients that are pushing a cart in Target or driving down the road trying to do medical visits, telehealth visits. It's really important that the patient be in an area where they have some semblance of privacy. You really don't want them to be in a public area. Again, we have templates on our website that can help guide you. We're creating some infographics around telehealth decorum, both for patients and providers, to kind of address some of those issues. And then as far as website manner, I'm going to go through a couple of different things and show you some examples. And we'll talk about that video etiquette. I've already mentioned consent forms. As far as vital signs go, it depends on what type of service you're conducting via telehealth, but you may not need vitals. Most patients do have thermometers, scales, maybe blood pressure cuffs in their home. Maybe they have tracking devices they wear on their wrist that they can tell you about their pulse, those types of things. It is okay to use that information and record that. As you record it in their patient record, make sure that you mention that it was obtained by the patient and they provided those vital signs to you. So this, we're going to talk a little bit about eye contact, the junk in your trunk, which is your background, and lighting. So what's in your background? These 2 examples here are very messy offices, and I'm really not sure I'd trust a provider if this was in their background. I might not trust a patient if this was their background, but we often don't have control over that. The biggest thing is we want a clean and uncluttered view between the webcam and your eyes. So while I've got 2 screens here, when I'm looking over here, this is my slides are on this screen, and my webcam and my self view are on this screen. So I'm trying to look either at my self view, which is here, or at my webcam, which is there, to mimic that eye contact that we would have if we were in person together. So camera positioning, you want to think about that just like you're getting your picture taken, and you want to look at that camera. So that is going to help you mimic that in-person situation. Distractions, like I said, I've got my door closed and locked. I've told other family members that I'm doing a webinar, you stay out of my room, don't knock on the door, keep it quiet out there. If I were taking notes, now I might be typing and taking notes over here, or I might be typing on this screen and taking notes over here, or I might be grabbing a pen and taking notes down here. Now, if I grab a pen and I'm taking notes down here and my voice is coming down here, I am not at all connected to my patient. So you need to be overly clear and transparent with your patient about what it is you're doing. Oh, hang on a second. I'm going to make some notes over here on this screen. Okay, take your notes and then come back to the patient. Same thing if you're going to write notes down. If I'm looking over here at my window and talking this way, you don't have a good connection with me. External noises, I mentioned them again or already, but here are some acoustical things that you can do about external noises. You can buy fabric. If you have a home theater geek in your life, you've probably heard of sound absorbing fabric, or if you've ever been in choir or orchestra or band, you've probably seen that in those rooms, those practice rooms. You can get ceiling tiles that absorb sound. You can add carpet on the floor to absorb sound. You can hang draperies. You can even buy paint that absorbs sound. And lighting, I do have a little bit of a shadow here, but I have a craft light that is a clear daylight bulb above me on my hutch, and I turn the gooseneck on that up to the ceiling so it bounces back and provides soft lighting. I don't use fluorescent lighting. I don't use other lighting behind me that might create a halo or a glare. So here's an example of a really bad glare. It's very difficult to look at this person and see, to pay attention to what is written on this page that she's pointing out. Here, if we change the angle of the camera, it's much easier to look and see, and you can better see the words on the page that she's pointing out. Here's another example. Now his background is really pretty good, except for those slides. If he closed those blinds, it would probably be much better, or he could hang a curtain over them. So ideal wall colors, a light blue or light gray work well with all skin tones. So again, the point here is you want a clean and uncluttered view between the provider and the patient. And we're almost up to time, but I do want to open up for questions. The link to the assessment in the chat on here. Jenny, I am not sure which assessment you're talking about. If you could provide me more information or send me an email. Carolyn will take today's recording. We'll post it on our website. We'll make the slides available for anyone that wants them. Any other questions? All right. Well, thank you very much for attending today. I hope this was helpful. Have a great rest of your day.